Great. Thank you so much for that extremely informative and thorough presentation, Brenda. That was
Oh,
great.
you're most welcome.
So before we begin our Q&A session, can you let people know how to get in touch with you, where they can follow you, where to get your books? Obviously, we have your books available through our bookstore at therealtruthabouthealth.com. But just where can they get in touch with you?
Yeah, so they can get in touch with me via Facebook or via my email, which is Brenda Davis at tellus.net. And my website is brendadavisrd.com. We have websites for most of our books as well, Plant Powered Protein. I think it's .ca. So those are probably the best ways of getting a hold of me.
All right, great. So now we're going to begin our Q&A session. We just have about 15 or maybe a little bit more minutes left. If anybody would like to ask a question, you can go ahead and raise your hand in the Zoom. We don't take questions from the chat. And I'll go ahead and ask the first questions. So, what studies and research have been pivotal at you coming to these conclusions and forming this, this design for the whole food plant-based diet as the optimal diet?
Well, the studies that have really impacted me are the studies that I mentioned at the beginning: the Epic Oxford, the Adventist Health Study, the Suchi studies that compare people eating, living similar healthy lifestyles and eating different dietary patterns, and looking at the differences in their disease risk and their longevity and so on and so forth. I think those studies are really, really important studies, but a lot of the studies that that have looked at the Healthy Plant-Based Diet Index and their impact on disease. I think those are very important studies as well. And certainly we have a number of studies that have looked at the nutrient intakes, and of course a lot of those studies come from Epic Oxford and Adventist Health Study as well. That have helped us to understand what nutrients we need to be more or less concerned about. So these are studies that I think are really critical to plant-based eaters.
And you mentioned early on in the presentation about bone health and
Yes.
with regard to vegans actually having an increased likelihood of breakage, specifically women, I think in their postmenopausal years.
Yeah.
How or what are the best ways to avoid having that issue for that population?
Yeah, to me, there are really two key things. Number one is to be physically active. Being physically active, doing weight-bearing exercise every day, it gives your bones a message to stay strong. And so physical activity is number one. And I would recommend an hour of good physical activity every single day, walking whenever you can, but doing some of the weights and some of the HIIT classes, or whatever kind of exercise you prefer, but it does need to be some weight-bearing exercise. And then secondly is to make sure your diet provides the nutrients that are so important to bone health. So we need enough protein. Protein is used for building and maintaining bones. We need enough calcium. We need enough vitamin D. We need enough vitamin K. We need enough potassium and zinc, and the list goes on, but we need to have a good varied diet. We do tend to fall short quite commonly on calcium and vitamin D, and so those are nutrients we need to pay special attention to. And so if it needs to be a supplement, then most people need to take a B12 supplement. There's just no question. Vitamin D, I mean, we just got a whole pile of snow today in Calgary. I'm in a winter wonderland. So here we are in April, and it's like winter. So we are going literally from October to April with no vitamin D production whatsoever. So we need to rely on food or supplements. And as I said, we don't get enough from food. So for most of us. So then, the supplement becomes pretty important.
Okay, and thank you for that. So now you had a slide that featured, getting high quality supplements. and you had B12, D, iodine, omega-3. Previously, you'd also mentioned other, other important nutrients, just zinc, etc. Are those four supplements the ones that you recommend that people on a whole food plant-based diet take, and perhaps everybody? And are there other supplements that we should consider taking?
Yes, so certainly we all need to be taking B12. Most of us need to be taking vitamin D, unless you're in, a lot, you are exposed to a lot of sunshine, and you've had your levels measured, and you're good to go. I think most people need vitamin D, and then of course iodine. It depends on, do you use iodized salt, or are you using a lot of seaweed, or even a small amount of seaweed, you may be getting enough. But if you're not doing either of those, then you need to have a reliable source, and a supplement is a good reliable source. And then EPA and DHA is still very controversial, but in my opinion, I think it's a very, very reasonable thing to do. I take it myself, and I think most people should be taking some direct source of long chain omega-3s, which means a supplement. Now, for some people, especially people that their diet is sort of all over the place, they may want to take a good quality whole food multivitamin mineral supplement. So they get the trace amounts of selenium and choline, and there's some other nutrients, zinc, and maybe a little extra iron, and so that's a very reasonable option in my view as well. And if you're doing that, you may get enough of some of those other nutrients, like iodine. Is often, you can check to make sure there's iodine in your multi, and then you wouldn't have to do a single nutrient supplement for that. You may check for B12 as well, and so if you're doing a multi with B12 and having some fortified foods, you're probably doing just fine. You may want to top it up with 1,000 microgram single nutrient B12 just to make sure. But in my experience, people who are doing some fortified foods and a little bit of B12 supplement, their B12 tends to be very, very good.
All right, great. Now, with regard to EPA and DHA, you mentioned that it's a bit controversial. I know Dr. Joel Furman is a big advocate for it. I think last year, Dr. Michael Clapper said he wasn't really into taking it, but then Joel Furman persuaded him that it actually was worth taking. Can you describe the controversy?
Yeah, so the controversy has been really that EPA and DHA are formed from alpha-linolenic acid from plants in the body. And so some people are thinking that, well, if you take it directly, you may compromise your ability to convert, and that I'm going to back up a little bit. So ALA is converted, but not very efficiently. So most experts will say maybe 2 to 5% is converted. We've seen better conversion in women, up to 36% to EPA, DHA, and DPA. We've seen reasonable conversion to EPA in men, and even to DPA, but not to DHA in some studies. So there is a group within the plant-based world that believes that supplying EPA and DHA is not a good idea, that it might increase risk of prostate cancer, these kinds of things. And so we shouldn't be taking it. There's another group that believes that because our conversion is so inefficient, and because vegans and vegetarians, and especially vegans, have much lower blood levels of EPA and DHA, probably about a third to a half of what omnivores have, that it makes sense to take EPA and DHA directly, and especially because it's so important to brain development in infants and children, and to brain health long term. That why risk it? We may as well just take it. People who eat fish twice a week, we look at how much they get, and then we say, well, we'll divide that by 7, and we'll consume 200 or 300 milligrams a day to equal what people eating fish twice a week would get. And so to me, that's a very, very reasonable choice. As I said, I do it myself. And I think not doing it could put us at some risk. So I'm definitely in favor of EPA and DHA.
Okay, and you mentioned earlier in your presentation about the Marshall Islands. Can you provide an overview of the diabetes lifestyle medicine trial that took place in the Marshall Islands and its outcome?
Yeah, sure. So we basically went in and we interviewed many people and found people that were able to be part of our study, that had A1Cs that were above 8, that were essentially, that had type 2 diabetes. And then the people that qualified for the study, we randomized them to either a control group or an intervention group. And the control group continued to receive the usual care. So they would continue on their medications. They would, continue with the diet they were recommended for their diabetes and so forth. Whereas the intervention group received a very intensive lifestyle intervention. So they were literally with us for 4 days a week for probably 5, 6, 7 hours a day. It was, quite intensive. So we would feed them breakfast, lunch, and dinner. We would do nutrition interventions, or nutrition education sessions, teach them to read labels, bring them to the grocery store, do exercise classes every day, go for walks with them after the meals. So it was very, very intense intervention. And we saw just remarkable results in very short order. To be honest, I was shocked at how fast the blood glucose levels normalized and people started to feel so much better. So our results were good. The biggest problem with our intervention was that our blood work, we lost a lot of the blood work, because basically we would get the blood work done, and then the blood work would get sent on to Hawaii or whatever for assessment. And it didn't always get sent appropriately or safely or efficiently time-wise. And so some of the results then were not, valid because the blood work wasn't good. So that was the biggest challenge there, was to keep our lab results usable. But essentially, the study was a really quite a wonderful experience. When we got to the Marshall Islands, people didn't walk. They basically took a taxi, even 2 blocks, because taxis were 25 cents. And if you walked, it was because you were too poor to take a taxi. By the time we left, there were walkathons for the whole population, that everybody was walking. We brought in free running shoes. We got, we got some good changes. The restaurants started having, diabetes wellness, menu items, and the grocery stores started carrying healthier foods. And so it really did have an impact. And the church groups and the government groups and the teachers, and they all wanted us to, go in and provide, just educational sessions. And in 2017, I went in with a colleague, and we created a new curriculum for all the public schools for nutrition. So they continue to ask us to do things to help reduce the diabetes epidemic.
That's really amazing impact. So can you provide an overview of the recent studies that compare the rates of dementia among those following long-term vegan diets versus the general population?
Yeah, so there haven't been a lot of studies on vegans, to be honest, but the Adventist Health Study too found that healthy plant-based diets showed better memory and language ability. People that were consuming those diets compared to the omnivores. That was, I think, in 2021, and then there was a 2022 that a study from Adventist Health Study 2 that reported slower decline in global cognition and memory in African Americans. And in 2022, there was a Taiwanese study that showed vegetarians had a 33% reduced risk of developing dementia compared to non-vegetarians. And these participants weren't vegan, but they're very close to vegan because, as you know, Asian vegetarians aren't big dairy consumers. They tend to have a little bit of egg in the diet, but very, very little dairy. So it's a very near vegan diet. And then the other thing we have is we have a number of studies that have actually looked at sort of the plant-based diet index and plant-based diets generally and cognitive function. There was one out of China, I think it was 2022, that looked at the highest quartiles of the plant-based diet index, and they were associated with an over 50% decreased risk of cognitive impairment. But I think it was every 10-point increase in the HPDI was associated with a 30% risk reduction. And another study, a 2023 study out of China, showed that those that had the largest increase in HPDI had a 28%, I think it was, lower risk. And then another study out of the Czech Republic did a review called, it was basically a review of vegan diet on Alzheimer's disease risk, and plant-based diets like Mediterranean Dash, Mind Diet, which are all largely plant-based diet, showed reduction in cognitive decline, but they just had very limited evidence for vegan diet, so weren't able to make any huge pronouncements. And so we're still at the stage where, we know that plant-predominant diets are protective, but in terms of vegan diets, we still have lots of work to do.
All right, great. Brenda, thank you so much for all of that information. That about wraps up our time. So if we can unmute the audience, so everyone can say thank you.
Thank you.
Thank you, Brenda.
Thank
Brenda
you.
loves you.
Amazing.
Great.
Loves you.
Brenda.
Thank you, Brenda.
Brenda.
Such basic
Big
information.
information.
Or Richard.